Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and I'm happy to have back Dr. Hunter Moyer, board-certified plastic surgeon with Monument Health. I think you now have taken the record for the most podcasts, Doctor.
Okay.
We'll get you a plaque when we're done.
All right. Something for my refrigerator.
Yeah, exactly.
Yeah.
No, if you want to hear some of the past episodes you've been on, episodes 10, 14, 16, and 35 is what we've had you on. And, you know, we've covered all of the big hits, I think, that you do for sure, from facelifts to breast augmentation, breast cancer, rhinoplasty. We've worked on that too. So I'm happy to have you back a bit to kind of drill down and get a little more specific on some of these other procedures that you perform.
Sure.
So this is kind of a three-part episode in one part with chemical peels, lasers, and dermabrasion, correct?
Mm-hmm.
So let's just start breaking those apart. Let's start with chemical peels, Doctor.
Okay. Well, and so let's start from the beginning.
Okay.
So, the idea behind a chemical peel, laser, dermabrasion is you're using a different form of energy to affect the same end. So the end goal is to strip off the outer layer of skin.
For all three of them?
All three.
That's the point.
That's the end goal. And so let's take a step back then and think about skin, right? We all know that there's the outer layer, the epidermis, and then the inner layer called the dermis. And the epidermis is what, those cells slough off. You can kind of see that white kind of dead cells slough off. And so that outer layer regenerates itself. And so it starts from the bottom to the top. And when we're young, it takes about 21 days for that process of the base cells to come out, right, to the top, and then they slough off. That all starts at the basal layer, and there are stem cells in there that continually regenerate those cells. And then under that is the dermis, and that's where your collagen and elastin is, right? And so if we're talking about wrinkles, then we're really talking about the deeper layer, the dermis. If we're talking about just poor-looking skin or, not youthful-looking skin, then we're talking about the outer layer. If you go to the beach and you get a bad sunburn and you blister, we call that, there's different layers of burns. Mm-hmm. And so a first-degree burn is where you get a bad sunburn. And so that injury went down to the epidermal-dermal junction. If you get a second-degree burn, that's where you're down in the dermis. And we actually separate the second-degree burns into superficial second-degree and deep second-degree. Now, why don't we just call them second, third? I don't know, but we do.
Sure.
And the reason we do that is because how deep it goes in the dermis will determine whether you will heal without scarring or you will heal with scarring. And the key to that is the hair follicles and the sweat glands that extend down into the dermis, because around the hair follicles and the sweat glands are stem cells also. You have stem cells at the basal layer, and then you have them down at the hair follicle roots. If you get a second-degree burn that does not go past where the stem cells are, you will regenerate skin without scarring, and it'll actually look better than it did before, honestly. If you go past that to a deep second-degree burn, you will scar, because there are no longer stem cells there to heal that area. And then, of course, third-degree burn is all the way down through all layers, and that's bad too. So if we think about burns, first, second, and third, and then we think about, well, instead of a terrible burn injury, can we do something to remove that outer layer of skin and even get down to the superficial dermis, still leaving the stem cells behind, but then also causing the deeper dermis to, one, make more collagen and elastin, and two, make a new epidermal layer that's more youthful. So am I making sense?
Yeah, absolutely. Yeah. The whole sunburn analogy has helped.
So that's the idea between chemical peels, lasers, and dermabrasion is we're going to give you a really bad sunburn, even past like first degree, superficial second degree, with the idea of regenerating a new outer skin layer. That's it. Now, when you think about chemical peels, what is that? It's an acid. We're using an acid to burn your skin. Dermabrasion, we're basically using, it's called a diamond phrase, and it just rotates at 30,000 RPMs, and we're basically just like sandpapering your skin off. And then obviously a laser does it with light energy. Mm-hmm. So, but again, same idea, or same end goal. Chemical peels have been around forever. I mean, if you look at Egyptian writings and hieroglyphics, they would put milk out in the sun to sour it to make lactic acid and then put that on their faces. So the chemical peels are not new.
So we have wanted to look young for literally millennia.
Yeah, this is nothing here is new.
Right, okay.
So, and we have better peels now. We have different types of acids, and you can control depth. But that's, using an acid to burn your skin, honestly. Dermabrasion, like I said, that's a diamond phrase, and the nice thing about that is you can really control it. When you do a chemical peel, you kind of paint the face, and it just kind of dissolves, or not dissolves, but dissolutes into the skin based on your skin level and everything else. But with the dermabrasion, I can really kind of focus on an area, focus on scars. So that's a great method. And then lasers are the newest. They are relatively new. We know that. And so I don't know. Do you know what laser stands for?
I believe, I'm sure I learned it back when I was in high school. Yes, but I don't remember off the top of my head now.
So
wait, hold on. Let me see.
Yeah, you give a guess.
Light amplification.
That's fantastic. Yes.
By the stimulation of. I don't. What's the ER?
That's fantastic. That's better. That's 3 better than anything else.
Oh wow, good.
So you're right. By the stimulated emission of radiation.
There we go.
And so that's a laser. So what is it? Let's boil it down because it is high school. It's quantum physics. All right. So we know that obviously there's an atom with a nucleus, and there are electrons that go around in certain shells, right? The first shell, the second shell, the third shell. And so quantum physics is we never see those atoms in between. They either jump from the first shell up to the second and then fall back down, or from the second to the third. And so that's the idea behind quantum physics. Well, what happens when those electrons fall down a shell? They actually emit a photon of energy, right, which is, kind of drawn on a piece of paper like this. And they emit a photon of energy that always has the same wavelength, in the same phase, and the same amplitude. And so if you get, we call it a medium, but if you get a whole lot of atoms together, they're all the same, you excite them, and then as soon as you stop exciting them, they drop down from one shell to the next. They will emit all the same photons, all the exact same in phase, color, we call it color wavelength,
right,
and amplitude. And so what does that mean? Well, if you focus it, then you've created a beam of light that has a ton of energy, and it can bore through a hole, right? So you can use it outside the visible spectrum, we call it. You can use it to just, basically burn through skin, like we're talking about with acids or peel or dermabrasion. The other thing you can do is, because you can focus it to a single wavelength of light, you can then treat tattoos. You can treat, darker colored pigment, things that you don't like. The reason for that is, so you have let's say you have multicolor shirt on.
Yes.
But let's say the blue part. The reason it looks blue to me is because it's absorbing every other color on the visible spectrum, but emitting blue.
Right.
So I see it blue, you see it blue. What that means is, if I wanted to try and burn blue, I would actually use a wavelength outside of blue, because it absorbs that one and reflects the other. So if I'm going to treat a red tattoo, I'm going to go to the opposite side of the visible spectrum, hit it with a laser of the color of the opposite, because that we call it chromophore, but that blue will absorb it, and it will absorb it more than anything else. And so it'll take that energy and basically kill that pigment or kill that cell, while not killing the surrounding cells, because they're not absorbing it as much. I know this is getting kind of far out, but does that make sense?
Yes, it does. So completely, yeah.
The key to lasers, the new technology, because the other ones have been around forever, is you can either just, burn everything that you want, we call that, ablation, or you can target colors. That's new. Haven't been able to do that in the past.
Really, that's recent.
Okay. I mean, with lasers.
Right.
With lasers, yeah. And then the other thing we can do with lasers is, we talked about how, the whole idea is to just strip off the outer layer of skin and create a new layer of skin. The nice thing with laser, and some people might have heard fractionation of a laser. So what you do with that is you burn the outer layer of skin off like you do with anything else. And then you take the fractionated part and you drill holes into the deeper layer, like you're aerating your lawn. And what does that do? Well, it doesn't cause scarring, because you're leaving behind areas with intact hair follicles and sebaceous glands and stem cells, but you're injuring and stimulating deeper down to make even more collagen and more elastin. So that's something with a laser you can do that you can't do with dermabrasion or chemical peel. It's basically like aerate the lawn and cause more stimulation of collagen deeper down.
Wow.
Make sense?
Yes, it does. It's amazing how kind of they all work together, but they're so vastly different in so many ways.
And,
right?
and they are, so and each one is better in certain areas.
Yeah.
Yeah, like if you want to do a full face, just, skin rejuvenation, a chemical peel is fantastic. It really is easy. It's painted on. We do it in the office. You don't have to go to sleep for it. It's not terribly painful. If you want to do specific scars, or specific areas, dermabrasion's great. I have complete control of it. I can control the depth. You can paint it a little better instead of just mask.
Right.
And then obviously if you want for lasers, if you want to treat tattoos or chromophores or colors, they're the only real option. There's BBL and other things. Or if you want to fractionate and really, really treat even deeper wrinkles, laser is probably the best.
So let's say somebody comes in that's listening to this, sensitive skin, like darker skin tones.
Yeah, that's correct. Yeah.
So what there must be factors you take into consideration then to choose which one's safer, right?
Yeah. And honestly, all three can be unsafe on certain skin tones.
Okay.
So, we call it Fitzpatrick skin tones 1 through 6. And so as you get darker and darker skin tones, you get towards the 6, and lighter, sweeter skins are towards the 1.
Okay.
You have to be careful when you're at Fitzpatrick 4, 5, and 6 with any of these technologies, because the risk of hyper or hypopigmentation after a chemical peel laser dermabrasion is way too high. So these unfortunately aren't great options for skin tones 5s and 6s. And even 3s and 4s you have to be very careful with. Mm-hmm.
I'm just, so what, when you said the term hyper, which
hyper or hypopigmentation.
Yeah, what does that mean?
So for me, I'm relatively light complexion. Right.
Yes.
And so hyperpigmentation would be I have something done and then I get splotches quite a bit all over the place of darker areas, more melanin production.
I see. Okay.
Hypo would be that I have it done and then I've got white areas. And so we don't really see that in Fitzpatrick 1, 2, and 3 skin, but 4, 5, and 6, which are skin types that produce more melanin,
yes,
can either create too much or stop creating in certain areas if you're not careful. And really for 5s and 6s, it's just the risk is too high.
Okay. What's after procedures like this are done then, what is typical downtime or aftercare for stuff like this?
Well, and so, the other thing is there's such thing as microdermabrasion and dermabrasion.
Okay.
And, very light chemical peels, and then the chemical peels that we do in the office. And so microdermabrasion and light chemical peels, there's not much downtime. With what we're doing with real, true dermabrasion with depth, true chemical peels, we do 2 actual peels back to back, decent depth, and a decent laser, you're going to look a mess. Honestly, you're going to look a mess. You're going to be swollen the next day. 2 days later, you're going to start peeling flakes of just, big flakes of skin. You're not going to be outside. You're not going to be talking to your friends. You're not going to be shopping.
Ski mask.
Of course, you're applying cream, so you look like a mess.
Right.
You're just gooping stuff on. So, it's a good week. It's a good week because the skin will actually peel off in about 5 days. You're left with a little bit of a pink complexion. So, and after about 7 days, makeup is fine to put on it. But yeah, you're out for about 5 days.
So is there is that's kind of the norm for all of these? Are there any that take longer, or are there
Generally
some
not? And there are different lasers. There's a CO2 laser. There's an erbium YAG laser. These are all the mediums that we talked about of like what is the atoms that we're using.
Right.
And some do a better job of ablating tissue without. It's all about affinity for water, but some do a better job with less swelling and less recovery.
Oh, I see.
And so erbium YAG is generally better than CO2. But within a little bit of like a day or two, it's all about the same.
Okay.
It really is.
So is it mainly done cosmetically, the people that want these kind of procedures, or are there actual medical reasons why some people get these too?
So in my practice, it's cosmetic.
Right.
So if you have really bad scarring and you want to dermabrade that scar because and that can be cosmetic too.
Sure.
But, you can also dermabrade scars that are inhibiting or weighting down an upper eyelid.
Oh,
so
sure.
There's some instances where this could certainly be.
Yeah.
Yeah. And, and then we get into scarring of, you probably heard the term of hypertrophic and keloid scarring, and that's bad scarring.
Okay.
Hypertrophic is basically just a bad scar.
Okay.
Your immune system reacted much more than we expected, and so you have a thick, raised, hypertrophic scar. Dermabrasion is great for that.
Oh, excellent.
A keloid is different. That's actually a benign tumor where you get a bad scar, but it starts to grow outside of the bounds of the original scar. So a hypertrophic scar is like a bad scar right here where you got cut. A keloid is where it starts to grow, and like an ear can become a giant cauliflower.
Really?
And so that's a benign tumor, but that's radiation treatments. That's other things.
Are there over the counter things that people try that you would just wish they wouldn't do on stuff like this? Are there things that people would shy away from?
Well, so what's been proven for scar healing? Really, and there's some newer techniques out there, but silicone and silicone sheeting is the only thing that's really been proven to improve scars. It will not stop scars. It will not take scars away.
Right.
But silicone and silicone sheeting over a scar after about 2 weeks up to about 2 months has shown decreased thickness of the scar and pigmentation of the scar. And we think we're not exactly sure why, but it's probably hydration. It keeps water underneath the silicone sheet, because silicone is relatively hydrophobic. And it also seems to, in some studies, it seems to polarize the wound. Don't ask me how, but this silicone sheeting kind of creates a positive negative perpendicular to the wound edges, which does help to line up collagen fibers directly across the wound instead of just a haphazard.
Okay.
So silicone sheeting is great, or silicone tape. We use silicone tape. Vitamin E has been talked about for a long time. You hear it quite a bit. Vitamin E is, in lab studies, has shown improved fibroblast migration. What does that mean? Well, it just means that fibroblasts are the main cells that make collagen for you as you're healing the wound. In vitro studies in the lab, it seems to kind of like hone in or help migration of fibroblasts. So the thought is that would actually help scar healing. In actual true clinical studies, no difference. And in fact, some patients, not much, but 2 to 5% of patients actually get a folliculitis, which is basically an inflammation from the vitamin E. So I do not recommend that, because if it doesn't do anything, and then if you get inflammation around it, it makes it worse.
Yeah.
Mederm's the one that you see in the aisles all the time. The main ingredient, you read the back, there's 30 ingredients. The main one is basically onion skin extract. Same thing. In a study sponsored by the company, there's improved healing. In any independent study, no difference.
Really? Okay.
Yeah.
I'm assuming, though, in this profession too, with these three things we've talked about, there's, let's see, the chemical peels you said have been around since the Egyptian times, and the lasers are the newest thing. Is there anything coming on the horizon now, next, that they're working with that you're kind of excited to try or to see what's going to happen, or are these really the options, and we'll just perfect these options?
Well, what can you predict?
Yeah, that's hard for sure.
That is tough. Now, lasers and heat energy. This is all energy. We said
right.
It's acid. It's mechanical energy, or ideas of in making a little tiny incision and putting a wand in, right, that has kind of a laser tip to it, and then let's say under my chin here, in my neck, to tighten the skin from within. That's not brand new, but that's kind of a new idea of how do we take a laser and improve it or use it somewhere else.
Yeah.
The problem we've seen, and that was kind of big in Atlanta about 7 years ago, it kind of came out and I was there, and the problem is that the energy distribution was not even. And so you got some tightening. The problem is you got tightening and no tightening and tightening and no tightening.
Okay.
And so
it's like waves over here.
It could be really bad.
Boy.
Or even in liposuction. I think we talked about liposuction once. We have, they put lasers on the end of the liposuction cannula to try and heat the skin. Basically it's like, if you've got this technology, every round peg is a square. You got to hammer it. Everything's a nail. Same thing. Right. Laser-assisted lipossuction. They called it smart lipo. We talked about that. That's brilliant because no one wants dumb lipo.
Yes,
right?
exactly.
So
right. Good call.
Smart lipo. Yeah.
Good on marketing there.
That's fantastic. Because they call you and you tell them you're going to do dumb lipo. That's not so good. But with smart lipo, with this laser, the idea was again to tighten the skin from underneath as you're liposuctioning. Same thing. Ripples, more seromas, more so. So. That's an aside of, yes, lasers are being incorporated into a lot more things than just skin resurfacing. As far as skin resurfacing goes, I don't know of anything coming on the horizon just yet.
Okay.
We talk about infrared technology, diode technology, and these are still light-based.
Right.
But diodes are used in spas and at home, and that's kind of an interesting advancement from
Are
lasers.
those the ones with the masks that you see people wear sometimes?
Or you're on the airplane and they've got this helmet.
Yes,
you put on your
exactly.
Head. Yeah.
Do those work?
They do.
Oh, they do.
But hold on.
Yeah, please.
Yeah. Shouldn't say that. So the idea behind a diode is it emits a color and it's within kind of the same wavelength. So a diode is like the Diet Coke of lasers, but like the really weak Diet Coke of lasers.
Okay.
So if you look at a laser, at 690 nanometers, it's like all the energy. Diet Coke would be down here with a little bit of energy focused around that area. And so it's definitely not a laser. It's not going to burn your skin. But if you put it on an area long enough, and there's two main colors that are used, red and blue. Blue is actually used for cystic acne. And the main reason, so that's bad acne.
Yeah.
We've all had acne. But that's the kind where it's infected and just pustules and awful and miserable. And the blue laser actually inhibits a bacteria that gets into this, Propionibacterium acnes, or kind of a name change recently.
Right.
But it actually heals and helps improve cystic acne for teenagers. And so the blue does that. You have to put it there for a while because it's not a laser, it's a Diet Coke laser, so it's got to be there for a long time, but it does work. And red LEDs have shown to help with wrinkles, but they basically have to be there a long time. You have to do it a lot. And it's all about the amount of energy you can deliver, the fluency of it, how close those diodes are. So my initial response was, yes, they do work. And the reason I know this is because back in Atlanta when I was kind of investigating this stuff, we came up with a system that would fit on your cell phone. So instead of having to go to the little spa down the street or get these things, we basically made an array of diodes, blue and red, and you plug it into your cell phone, and you hit an app, and it would turn on, and you could take pictures and see if you're doing anything, and then you just hold it there, because we figured, you got your cell phone all the time, you forget to do this or that, so you'd kind of put it in certain areas if you had acne. We made red ones. And then we did a little pilot study of, so I had 5 different patients, and they did it on a daily basis, and they put the red kind of laser, which helps with wrinkles, right on the upper eyelid. And then I had a 3D MD camera, and we looked to see if after 2 months of this, we saw any difference. They just did one eye, not the other, and we did. Now, it's not long-lasting, but so it does work. But these were relatively intense diodes that they did on a strict basis, and the phone would remind them, the app would remind them. So it does work. Now, in the ads on the, in the magazines on the airplane, those diodes are about, 2 inches apart.
Right.
Minimal energy. That's not going to do it. No. It's all a time and fluency.
Okay. Well, if that app would have done what you think, you would be on a beach on your own private island right now at this point. All right.
So, now we get to the business of medicine. You would think. So we actually took this to some of the companies that are selling these home devices.
Yeah.
And well, now we can get the business side, but we were talking about subscriptions and all these things, and the patent wasn't quite complete yet, and so it wasn't really taken for that reason. Then one of the companies down in Florida has been working on it to try and actually make it without our help. So,
oh, wow. Okay.
We'll see.
Yeah, that'll be amazing. Well, Dr. Hunter Moyer, thank you again for coming in and talking about this. It's always been a lot of fun to hear what procedures are available and what options are there, and what you can do to help us all look like Egyptians. Is that what I'm supposed to take from this? No, maybe not.
Walker,
sure, right. Dr. Hunter Moyer, board-certified plastic surgeon with Monument Health. Thank you for coming in and talking, Doctor.
All right. Good to see you. Appreciate it.